All right, so thank you guys for joining. I think I know just about everybody here, but if there's somebody who doesn't know me, I'm Sean Zachary, the founder of the National HBCU Auxiliary and Dance Directors Association, and this is our third installment in the virtual workshop series. So just to let you guys know, we will be putting these virtual workshops on for the duration. We were supposed to have a conference, and then y'all know that got canceled. So here we are. We're going to try our best to gather and to network and to learn with one another, to learn from one another. We will be putting out workshops and content, not just for coaches, but for our HBCU performers as well. So please stay tuned, and please join us whenever you can. So today we're going to be talking about strategies for rehearsals and performance during the COVID era. This workshop we were actually supposed to do earlier, but we pushed it back so that we could do a workshop on virtual auditions, because we saw people kind of needed that a little bit more. But now, as we're making it through summer and we're getting, some of us are doing camps and things of that nature, we wanted to go ahead, and because we felt that this was really important to do. And so I wanted to have, as always, I'm not the kind of person to sit around and just talk. I wanted to have an expert on board because I think it's important that we hear from someone, who knows more than we do about the topic that we happen to be discussing. And so I want to introduce to you guys Dr. Kelly Hall. And Dr. Hall is a board certified emergency physician currently working in urgent care with One Health Family Physicians. And she's practiced medicine for 16 years, 13 of those being in the emergency department. And over the past 2 years, she's returned to her true passion, which is dance. We were just talking about, she also owns a dance studio. So she's joined forces with former NBA dancer and hip hop dance studio owner, I hope I don't mess this up, Anna
Boise. Boise. It's Nigeria.
To become the new owner and chief operating officer of North Carolina Dance District, located in Charlotte. And she is known as a blue and gold marching machine legend, having the distinct honor of being the first female band director.
Drum major.
I'm sorry, not band director. Look, drum major in the band's history. Okay, and she is also a best-selling author featured in the HBCU Experience anthology, the North Carolina A&T State University edition. She resides in Charlotte, North Carolina with her husband, Eric. So everybody, please welcome our special guest for today, Dr. Kelly Hall. So I wanted to have her here so that, oh, and she's Tiffany's line sister.
Yeah, I was going to say I'm also Tau Beta Sigma and Delta Sigma Theta.
That's right, and Tau Beta Sigma and Delta Sigma Theta and Tiffany's line sister. So,
hey, Tiffany! Hey, Tiffany!
Okay, so yeah, so one of the things that I asked her to do is just to kind of talk to us a little bit about, the facts and the myths and just whatever information that she thinks is useful to provide to us as we begin to make our plans for, rehearsals, maybe performances, maybe not. All of that stuff is really still up in the air, but, for some of us. But so please welcome her and take it away, Dr. Hall.
All right, so I'm going to throw out a couple of disclaimers because as a hospital employee, I am not speaking for my hospital system. We have a whole media department for that. So this is all just kind of information from the hospital and the CDC, Center for Disease Control, but I'm not representing them. So that's that. Also a disclaimer, I'm not an expert in coronavirus, but at this point, nobody is because it's so new. So that's another thing. And as far as your own healthcare, you should follow the advice of your own healthcare professional. This is just advice. So I had to throw all the disclaimers out there. So basically, just to kind of start with what the symptoms of coronavirus are. Initially, it was just fever, cough, shortness of breath, and now it's a range from no symptoms to the fever, cough, shortness of breath, headaches, loss of taste, loss of smell, body aches, runny nose, congestion, chest pain. Now it's nausea, vomiting, diarrhea. So it seems like anything from the flu to a stomach bug to pregnancy. I actually had a sorority sister that thought she had coronavirus and she was pregnant. So it's random. The infectivity time is 2 to 14 days after exposure. And there's really not a whole lot to do if you have mild symptoms other than treat the whatever symptom you're having. Like if you're having body aches or fever, Tylenol, Motrin, there's conflicting information on whether ibuprofen can actually make symptoms of coronavirus worse. We don't really know, so we're just saying Tylenol, but you know, your cough medication, all that sort of thing. You should always, you know, contact your primary physician if you are having symptoms, see what they recommend. Testing varies from state to state, but at least for North Carolina and my hospital system, you have to have certain symptoms before you actually get tested, or you have to be required by your job to get tested before you can go back to work. So there's so many different rules as to who's getting tested, and then there's some that are just anyone can get tested. But those that test anyone, the lines are terribly long. Sometimes you have to have appointments, and then it's just insurance coverage. Like there's just, the whole thing is just a mess, quite honest. But definitely if you are having chest pain, can't breathe, if you're confused, lethargic, meaning like you're not waking up, or if you are, if your lips are turning blue or your face is turning blue, that's a reason to definitely go to the emergency department. So definitely if you're having any of those symptoms, you need to be seen. Don't sit at home because coronavirus can turn into something really seriously, really quickly. There's different tests. There's the viral test that actually lets you know if you actively have an infection. And so there's blood tests and there's nasal swabs. But the problem with testing is that depending on where you are, testing is limited. You have to meet certain criteria. And some tests are taking up to 10 days to get back. So by the time you find out that you actually have it, you've probably been around everyone and you've infected 1,000 people and you don't know. So that's the problem with testing. There is no national coordinated plan for any of this. So it's just piecemeal. Everybody's doing what their state or their county recommends. So that's a problem. But there's the antibody testing, and there's a lot of different ones of those. And some of them are home tests, and there's some that are on the internet that you can buy. Those tests aren't necessarily that accurate because there's so many different ones. So that one I would actually recommend getting from a doctor, but that tests whether or not you've had the virus, and that shows up positive after, or you show up having antibodies 3 weeks after you've actually had coronavirus. So it won't show up until 3 weeks later. So those are the kind of testing that are done. And it's spread by respiratory droplets, definitely. So the coughing, the sneezing, you know, the spitting, that sort of thing. But there's also thoughts that it may be aerosolized, meaning just breathing, you can spread the virus. So that's why the whole mask thing is important, and the 6 feet social distancing is important, because that's felt to prevent a lot of the aerosolization from happening. It's also possible that it can be transmitted by touching surfaces, but that's felt to be less likely, but still do clean and sanitize surfaces. Those that are at high risk of having complications from coronavirus are those that are older than 85, people that have kidney disease, lung disease, if you're immunocompromised, meaning like cancer or some autoimmune disorder, if you're obese, have heart conditions, sickle cell, or diabetes. So those are the ones that are at higher risk. And definitely the older you are, the more at risk you are. But we are seeing 20 and 30-year-olds that are ending up on the vent. And there's actually, I just heard of a 16-year-old that's in really critical condition. I heard that on CNN. So there are higher risks, but at the same time, anyone is at risk of having complications because there's no rhyme or reason to the virus at this point. So where we are now, the virus is spiking in at least 33 states. North Carolina is one of them. I know Texas is one of them. The testing is better. It's still nowhere where it should be because, like I said, there's so many people that don't have any symptoms, and because they don't have any symptoms, they're not getting tested. Well, but we really don't know how many people have it because there are asymptomatic people, and we're not testing everybody. So that's an issue. The virus is unpredictable. Every time we think we got it figured out, there's something new. But we do know that it's more infectious than the flu, but less infectious than measles. So it's kind of like middle of the way. And then there's the thought, well, or if you've already had it, you can't get it again. We're not sure about that. It's thought that that might be the case, but because it's so new, we can't say that for sure. And even if you do have antibodies, how long is that immunity going to last? We don't know. It just started in December, or theoretically December. I think it was here earlier, but whatever. And so as far as treatments, like I said, unless you are on the vent, like sick, near death, there's not really a whole lot we do. There's remdesivir, which is a hepatitis drug used for Ebola. Didn't really work for Ebola. That's showing some promise, but it's still early. Steroids kind of help out if you're on the ventilator, and I mean, at that point, they're just throwing stuff at you to try to see if they can keep you from dying, essentially. There's also plasma from those people that did recover from coronavirus that's found to be helpful, and there's an antibody drug that they're coming up with that's in like phase 3 trials, and so that's showing some promise, but it's still early. So at this point, there's no real treatment. Do not listen to the guy in the White House that said take hydroxychloroquine because that will not work, and you may end up with heart disease as a result of it. So don't do that. So basically, what should you do? Masks, definitely masks. Avoid touching the face. I mean, it's hard to do because it's just, you just do. Do use hand sanitizer, at least 60% alcohol. Wash your hands frequently. Do social distance. Try to stay 6 feet apart. If you're outdoors, it's a lower chance of transmitting the virus just because the droplets can kind of float off in the wind. And even indoors, if you're 6 feet apart, it's a lower chance of transmitting the virus. So that's, it's promising. But do clean and disinfect surfaces frequently. Don't share items, and do not have large gatherings, which leads to band camp. So at that point, I'm going to throw it out for questions and discussion, and let's go.
Yeah. I want to band camp and I want to talk about specifically outside, because I've told my team, I know it's Texas and I know it's hot, but we're going to be outside.
Good idea.
But there's still a lot of confusion around that. If you are rehearsing outside, how important still is the social distancing part?
It's still important because even if you're outside, I mean, don't touch people, don't share water bottles, how we do in band camp. It's like, it's just gross. So you share everything and you're all up on people. But it's definitely important to stay away from each other. And 6 feet is kind of like the measurement that is felt to be safe. And for instance, as a dance studio owner, we're actually having outdoor classes on Saturdays so that we can have a lot of people, but still we have cones out there and we're separating them 6 feet and telling people, not to touch each other. It's even better if you can still wear a mask because like I said, it's hard to stay away 6 feet away from people, especially if you're talking and you're trying to hear and you can't hear what they're saying. So then you're coming closer, and then there's that 6 feet gone. So, but then with the mask on, it's hard to hear. So, it's like a catch-22. You're trying to do one thing, but it just messes up another. But like I said, we are, even with my dance studio, we're dancing outside, and we're actually going to move indoors, but we're only going to allow 10 people per class, have one class per day. And our studio size is 1,000. Well, we have two. One is 1,000 square feet, and the other is 1,100 square feet. So we can social distance inside. And we're getting air purifiers, and we have garage doors. So I may just open the garage doors, even though it's hot. I'm thinking through it. We're starting it next week. But yeah, even then, I'm still trying to be as safe as possible. Hand sanitizer everywhere. Wear your mask if you can. That sort of thing.
All right. We have a question from the Educate Dancer Studio.
Hey, Tisha.
Hey, Kelly. Hey. Okay, so this is my question because I have little kids. So I wanted to ask if doing the tape and keeping them 6 feet apart, I wasn't mandating that they wear masks because I'm not even sure. I don't know. I don't want nobody to pass out.
Right.
So with it being indoors, do you feel like that setup is okay? Like having the 6x6 squares, we'll only be able to have about 10 people in there at a time.
Right.
Like you said, the center, is that effective if you're on the inside?
So I will say that the only way to know for sure that you're not infecting anyone or getting infected is to not be around other people. With that being said, that's the only way, but that's not going to happen. So with that being said, I am doing the indoor classes with 6 feet apart. And if people can wear their masks, then, if they're not going to be too stifled by it, I do recommend wearing them. I'm not the police. I can't mandate it. So I'm just having a little waiver saying, essentially outlining, this is what you should do. If you come out your house, you can get coronavirus. As long as you understand that, go ahead and dance. But I'm not going to force people to put on a mask or keep their mask on because I can't. I'm not a police officer. So is it guaranteed that that's going to be enough to keep people safe? No. But it's more likely to be safe that way.
So just making sure that those waivers are there and the policies are there and there's a plan and these are the steps. Everybody's not walking in and walking out. We don't got, parents coming in and dropping off. As long as that stuff is set up and it's in the paperwork, then it should be good.
But a lawyer can always fight it, but at least you got something to say that you're trying.
You knew.
Mm-hmm.
Is that too scary to put in there? Like, if you come out to dance, you could get the coronavirus.
So me and my business partner had this same sort of talk too. She was like, "Oh no, we can't put that in there." And I was like, "But at the same time, we have to because the fact of the matter is, it's most people actually don't read the whole thing though, because we have a waiver already that says if you hurt yourself while you're dancing, then that's your fault. Don't blame it.
Right.
So the fact of the matter is, half of them probably won't even read it, but at least you can say, listen, you signed this saying that you agreed. I can't say that you read it or not. You signed it.
Right.
Okay.
Yeah.
Thank you.
Okay, Maisha? Did she drop? Maisha, you still there?
No, I was coming off mute.
Oh, okay.
Sorry about that. Slow fingers. Hi, good evening, everybody. So I wanted to talk to you about outside rehearsals. As we prepare to get the paraphernalia together for our practices, one of the concerns I will have is slipstreams and droplet clouds, even when we're outside. So we're contemplating using face shields during practice. I want to know if that a waste of money investment or that, because I think operating with mask on in 90-degree weather for 2 hours is just not going to work. So talk to me about the minimalization of slipstreams and droplets as far as coronavirus is concerned, spacing out 12 feet apart with those face shields, and if that would be something that would be either a waste of money or something that could be done and feasible to prevent the spread of the virus should one of
the face shields alone are not enough because saliva can get around the shield. And like I said, there's a thought that there's aerosolization of the virus. And so even breathing can be a way to spread it if you are within that 6 feet parameter. So for instance, at work, for like 10 hours a day, I have to wear, at first it was just the mask, but now it's a mask and a face shield because we're coming into contact with patients, although we're theoretically not supposed to be seeing people that we think are at risk for coronavirus. So we have a whole lot of testing site for that. But the important part is the mask. The face shield is just an added barrier. So without the mask, the face shield is nothing.
Okay, so if they have the shields and they're 12 feet apart, not 6 feet, but 12 feet apart outside, that wouldn't work.
It's theoretically it should, but then there's so you know how hard it is theoretically to stay that far away from people, and you know, there's certain things you do without thinking, and so before you know it, you're 4 feet apart. So you know, it's everything is theory at this point. Like I said, the 6 feet is what we agreed upon so far, but in actualization, if you're thinking this out, like how easy is it to easily come 4 feet and have a discussion? So you know, it's even the most well thought out plans and the best intentions sometimes still, because of human nature, we're not used to staying that far away from each other. Mm-hmm. You know, it's just hard to not come together regardless.
Yeah, our thought was for practice purposes that of course they're in their spaced out 12 feet boxes outside. Of course, they're provided a shield and a mask. So during any type of interpersonal communication, when they come outside of their designated dance area, they're masking, but inside their dance area, they're just shielding. So, but that's helpful.
That's definitely safer. And can we say 100% that there's no way the virus won't be transmitted? No.
Okay, thank you.
I got a couple of questions here. Hold on. From Ray, when rehearsing inside, ideally, what does that look like?
At least 6 feet apart. It's you still, if you can, would like to put on masks, because like I said, it's hard to stay 6 feet apart. It's hard to gauge that you're remaining that far away from people. It's very easy to walk up to somebody and be like, oh dang, I'm supposed to be 6 feet apart, and then step back. Mm-hmm. So that's it. Theoretically, that should be good, but do know that that is not 100%. And especially if there's surfaces involved, because if you're touching things, even though it's less likely that you'll be transmitting the virus from a surface, the virus can stay on surfaces for a certain amount of time. So that's something else to think about.
But now that you bring that up, what about the floor? Because it goes out and then poof.
And down, right. So if you're rolling around on the floor, then theoretically, that's another area where you can possibly be transmitting the virus.
Oh, man.
Yeah, I'm not saying, I mean, you know, like you said, we're not really, it's not as transmissible, but I mean, if there's a lot of saliva on the floor and you keep rolling around on that floor, then that's more chances each time you roll around on that floor, there's more possibility of getting more virus. So should we not allow shoes on the dance floor? I would recommend shoes on the dance floor.
Okay. And let's see. Dr. Hall, some facilities are claiming they have an air filtration system that cleans the air of COVID-19. Can you speak about that?
I've heard about those. Nothing has been proven. So at this point, it's coronavirus hasn't typically been tested for those things. Other viruses have, and for my studio, I'm actually probably going to get some sort of air purifier. Can I say that it will kill coronavirus? I can't. But at the same time, it does help kill other viruses. So why not?
Yeah.
Give it a try.
Something is better than nothing.
Yes.
You know, my niece is a salon owner, so she bought a filtration system for her salon.
Yep. So, I mean, I definitely recommend it in general, just because any circulating air helps to make the virus diffuse. But we don't have any real documented evidence that it works.
Now, for inside, fans or no? Fans or no fans? Is circulating it a bad thing, or is it a good thing?
It could, if it probably would kind of push it to somebody else if you think about it.
Yeah.
But could it possibly elevate it too? It could. So once again, that's a thought that I was having for my studio is, should I have fans? Which is why I'm thinking about opening up the garage doors, because both our studios have garage doors. So I'm thinking of doing both and still having the air running and still having the air purifier. Like, you know, I'm pretty much doing everything.
Right. Okay. Let's see what else we got. Tiffany said the studio conversation is relevant for the college teams because we most likely won't have a typical season, right? And we will be inside doing skills, right?
Yeah. 6 feet apart, wear masks if you can.
Yeah. So we should not allow shoes on the dance floor, barefoot only?
No, wear shoes.
Wear shoes, okay. Should we temperature check every day when they come in, or does that not really help since people can not have symptoms?
Right. So that's my whole thing, because I was talking to a couple of the choreographers. One, she has a new grandchild, and she was asking, were we going to require, or was I going to check temperatures? And I thought about it, but I was like, the possibility that somebody that doesn't have a fever transmitting it is just as high as somebody having a fever. And there's so many people that I have seen with symptoms, but not a fever. So I was like, there's just no point. It's just wasting my time.
Right.
So other people are doing that. And actually for my medical office, because we have 5 floors of buildings or offices. When we come in, we're supposed to get our temperature checked. It's more so because at least you can tell definitively that somebody has some sort of symptoms. But there's other people that are going to be asymptomatic that spread it too without a fever. So whatever.
Right. Exactly. So so again, like Tiffany mentioned, most of us are going to be spending a lot of time inside. And I actually have one of my clinicians who has a studio. She puts the tape on the floor and makes the boxes so that people can kind of get accustomed to their space and their spacing, and that they should always be in a box.
Yep, that's essentially what we're doing. We have cones, but that at least helps, and it kind of gets it in your mindset that I should be staying this far away. Like if they can actually see something that says, that's a reminder, like, oh, I shouldn't walk up to them. It helps. So
right.
6 feet apart.
So what precautions should be taken regarding using and cleaning restrooms in studios and gyms?
Try to clean them as often as possible, which is hard because, I mean, how many people use the restroom all day? But I mean, use your Clorox wipes and your Lysol wipes and whatever wipes. We're going to clean them before and after class. And because I'm so OCD, I might go in the middle of class and start cleaning them too. But it's just, that's the problem with being around people, is that there's no way you can clean after every person. So
right.
That's why I said, you're still at risk of passing something along.
And we have another rule, which is no more than 2 people in the bathroom at a time. So that's one thing. But the other, this is where washing your hands and sanitizing comes into play.
Yep.
Because if you touch something, and I found myself like touching something and I'm like, oh.
Yeah, we literally have hand sanitizer like everywhere.
What do I do?
Yeah.
And so you grab, and if you can grab that hand sanitizer, then
anytime you touch something, that's why we have there's probably at least 9 bottles of sanitizer throughout the front of the studio and the 2 studios. Even though we don't really have a whole lot in the studio, but we still have the hand sanitizer around the cubbies, and so especially in the check-in area, there's 3 or 4 out there.
Right. Another question: are colder temperatures better to kill germs?
No. I think that's kind of like a rumor, because hospitals are always so cold. A lot of times when we sterilize things, it's in really hot temperatures. So I guess for some viruses that's effective, but there's not really anything that says that really cold is going to kill the virus.
Yeah. Now I know you're probably familiar with the ultraviolet ray machines that they're talking about, but I've been seeing on Amazon and these other places these little bitty bars with the ultraviolet light. Is that a waste of time?
That's probably a waste of time.
That's
I haven't seen those yet, but
yeah, I'm like,
so ultraviolet light may help, but it probably is at such a high power, so those little things probably don't have enough power at this point, unless somebody from the CDC says that it's beneficial. I would say that's a no.
Okay. So how are any of you on the call, are you guys, do you know, are you going to be relegated to virtual rehearsals and performances? Yeah.
I know we are doing virtual rehearsals right now. As far as performances go, because I'm with the marching band program. So they're saying we're still having a football season. So I'm not sure how that's supposed to work when the school system is going completely virtual, but they're still going to have football games. So I'm not sure how that's going to work out.
Are you in Texas?
No, I'm in Georgia.
You are Georgia, Texas.
Well, I would say that A&T, I'm a season ticket holder, and I bought my season tickets, and so they're still planning to have football games. They're trying to separate the different groups of ticket holders. And I don't know how they're going to do it necessarily, but they basically are going to limit the amount of people in the stadium. But then, how everybody comes in at the stadium at the same time. I'm trying to figure that part out.
As a dance professional and a doctor, do you think it is realistic to have a live competition season?
Is it wise? Probably not. But at this point, so this is my other, there's polar opposites to everything in my life.
Yeah.
At this point, the virus is so out of control that I really, unless we had proper leadership that said everybody get somewhere and sat down for 3 weeks, don't go nowhere, don't touch nobody, just sit down. The whole world needs to do that. So unless we were able to do that, the U.S. is just going to get worse. And with that being said,
how do we live with it?
Right. It's, I'm just at this point, there's no point, because people always feel like you're infringing upon their rights by telling them what to do. They're so selfish that they don't think of other people. So whatever, at this point, I'm just like, go for it. That's not the wise thing from the doctor standpoint, but that's just me being.
I go back and forth on it as well. I really do. And part of it, I keep trying to tell myself that I'm not thinking about myself, that I'm thinking about the kids.
Right.
The kids are going to want to do this.
Right.
You know?
Yeah, there's the one person that, you know, there's the scientist that's like, all of this is wrong. We need to stop. We need to get away from everybody. But then there's my other half, the dancer, the person that's just like, well, you can't stop people from doing what they're going to do. They're going to do it anyway. Right. So might as well try to help them do it safely.
Right. And here in Texas, they were still having some of the studio dance competitions. One of my friends, her daughter dances, and they just had a competition just this past weekend. So some of them, there's still competitions going on in Orlando.
Basketball is starting in Orlando.
Yeah, basketball is starting in Orlando. Soccer has already started. So yeah, no fans, but eventually they're gonna start letting people go in and watch and fans and things. So yeah, the competitions and stuff they're still having. I don't know.
You're darned if you do, you're darned if you don't.
Yeah.
That's where we are at this point, because if when we had those 15 people that we knew had the virus, if we did the social distancing, did the lockdown, we could have contained it at that point to where we wouldn't be having this conversation, because other countries have done that. They've proven it worked.
So here's another question. What are good ways to maintain color guard equipment during COVID?
It's probably less likely that those surfaces, the metal might be an issue, but like the plastic and like the fabric, you probably won't have as much infectivity with those. You probably may want to just wear gloves and take them off when you're not using them. That may provide some benefit. So that's a possibility. And sanitize them, like when you're done with them, like wipe them down.
Now I see that I don't want to mispronounce your name. Nadesia? Nadesia? Did I say that right? Was that right?
Nadesia, yes.
Okay, got it right. All right. But you said that you're already having virtual rehearsals. We are too. And I know a bunch of you are. But then y'all stopped because you said you were supposed to have band camp, but then they postponed band camp. We canceled ours. So we're one of the things that we are doing is when we show up for school, we're splitting our band into 4 bands, and bands A and B are going to be on Monday and Wednesday, and then bands C and D are going to be on Tuesday and Thursday. And so everybody will not be in the same place together unless either something changes or I don't know, that we, as we get through this and we start to see that maybe we have it under control, they may want us all at a game. From the SWAC conference just had a meeting yesterday, and none of the bands are traveling. I don't know if that is still the case for the SWAC Challenge, but I know that for the SWAC, no bands are traveling. They canceled the State Fair here in Dallas, so there's no State Fair Classic. There's no Bayou Classic. There's no Classic. There's no Classic, so nobody's going anywhere. We're not traveling to other places, so all we really have is an occasional home game. And so we have to come up with solutions, or, you know, again, because we still want a social distance, the band has to be spread out. And that's why we split into 4 bands, because once we get in the stands, the band has to separate itself.
Yeah, that's what I was imagining. I was like, the whole way that you're going to do the seating in the stands and the field shows is going to be completely different now, because you're going to have to try to space apart, and that's going to be a problem as far as hearing the music, because we always had a tempo problem. The larger the band was, you know, the sound would be so off. So it's just going to be a nightmare.
Yeah. And then we're not doing field shows either. So we're not doing field shows. The bands are just going to, you know, play in the stands. They don't want us to go down on the field because, of course, there's going to be a lot of sweat and other types of things in the turf. I think most schools have turf now. So, yeah, it's going to be interesting. But the next thing was, what are some of the things that we can do to keep our students engaged and keep morale up? And one thing that I told I told the girls, I said our online presence is going to be even more important now than it was before.